All right, what's up, everybody? I'm Dr. Dale Brown, the Wild Doc. We're going to be duking it out with a medical doctor. Not really back and forth, but I'm basically going to body slam the arrogance and ignorance of fake news, fake media, and the medical establishment that literally wants to do nothing more than basically chastise any claims by a chiropractor. I'm a chiropractor and I'm proud of it. And I'm proud of my chiropractic friends and chiropractors that are out there that are actually giving logical and scientifically validated information and advice and suggestions for people to do to support their immune system the way it's necessary so that everybody out there has what they need to be able to have the capability to fight off an infection. I don't care if it's coronavirus, it's the flu, it's Coxsackie, it's rhino, it doesn't matter. All these viruses are common cold viruses. They kill, you know what, if you took all of those classes, they kill hundreds of thousands of people a year, but it's really not the viruses, it's bad medical advice that isn't taking care of the underlying factors that would actually place somebody at a susceptibility to a viral infection having any detrimental effect on their body in the first place. And you're gonna see why I'm kind of pissed off with this. Fake news and bad medical physicians are killing hundreds of thousands of people per year because they want nothing more than to glorify FDA-approved drugs and vaccines. They want nothing more than basically try and shame and tell people that don't listen to a chiropractor, but yet you're gonna see in this video that chiropractors are the ones actually giving scientifically validated information out to the world to effectively support their immune systems to the point where it would be able to fight off an infection, and it includes coronavirus. I'm gonna back up what I say with scientific evidence, and I'm gonna show you firsthand with legitimate information that the medical physician that tried to put this chiropractor down in St. Louis, actually his hospital is rated one of the worst in the United States for the prevention of infection, but just wait what they're good at. All right, so here's the video, an article. All right, it comes from ABC News. This lady decides that her and her team are gonna fact check Dr. Eric Neputa. Give him a like, give him a thumbs up, go and like his page, all right? That a reporter right there is trying to put down Eric Neputa, a chiropractor that is willing to go out there and give logical and scientifically validated, evidence-based suggestions for people to do to support their immune system. She says, but doctors would say that there is no evidence that zinc or quinine or tonic water could help you in the fight against coronavirus. Actually, I'm sorry, you're completely wrong. And every medical physician that may have told her that is wrong as well. Because there was a 2010 study that actually said zinc inhibits coronavirus. And not just any coronavirus, actually SARS #1 coronavirus. The first coronavirus was actually inhibited by zinc supplementation. We've had research for 10 years. Nobody's been telling the world that, hey, if we come in contact with another coronavirus, maybe the second one, a mutation from this first one, maybe we ought to make sure that people aren't zinc deficient. Because if they're zinc deficient, their immune systems don't have adequate supplies to be able to inhibit the reproduction of a virus within your cells. So doctors who are telling this reporter that there is no evidence that zinc could prevent coronavirus infections or inhibit it or treat it, you are wrong, you are morons, and you need to shut up. I'm pissed right now because people are dying in a hospital because they're deficient in essential minerals and nutrients that are necessary that our medical physicians should have known 10 plus years ago. I got studies from the 1990s that show that zinc is an essential mineral necessary for proper immune function. That it could save millions of dollars. Just wait. The next day, low zinc in our elderly population. What is coronavirus hitting the most? What population? It's our elderly, those susceptible. Zinc deficiency is prevalent in elderly populations in nursing homes. In nursing home, folks. even within the United States. But doctors, the medical physicians, they don't want to test people's deficiencies. No, they want to feed them crap within the hospital and then say, wait till our FDA-approved drug comes out or our vaccines, and we'll mandate it that you take it. They don't care about actually assessing the true underlying factors that would put you susceptible to any infectious disease. They could reduce the mortality from pneumonia substantially if all they did was test and make sure that people weren't deficient in essential nutrients and minerals. They literally go here and say that a number of studies have been done on children and the elderly that have clearly demonstrated beneficial impact of supplementation with zinc alone on the immune function and the prevention of infections. Guess what? You're wrong. Doctors are wrong. Anyone who says that Eric Naputi's advice is bad advice or should upset somebody is an idiot. Any media person who says that doctors say there's no evidence. No, there's plenty of evidence. Doctors are just morons because they don't actually study the scientific literature. They are spoon-fed by the pharmaceutical industries into tricking people into thinking that God never provided. There's nothing you can do on your own. You have to wait till our gods of science, the FDA and the CDC and the pharmaceutical industry, deliver to us some sort of miracle drug that we're going to give you, which won't make a crap of difference if you are still deficient in zinc. You can give all the drugs in the world, but if you are deficient in things that your immune system needs, you're still going to die. No drug can save your life if you're deficient. Such studies have the potential to significantly improve the quality of life of the elderly, particularly those in nursing homes, and leading to healthcare savings on the order of millions of dollars. Now, here's the thing. You want to know why medical physicians, the scientific community, or the medical industry, the pharmaceutical industry, and why media doesn't care about saving money? Because that means loss of profits. That's what they care about. They care about the money they make and take from sick and suffering people. They want those millions of dollars. They don't want to save you, the population. They don't want to save money. They want you sick, suffering, and on their drugs so that they can profit off of your suffering, your sickness, and even your death. Let's go back to the video. Let's take a look here. If this doesn't upset all of you, if this doesn't upset you as a medical physician, you're probably pissed at me right now. All those medical physicians out there that watch my videos are probably pissed at me. Why? Because I'm pointing out the crap that you're pulling on the United States and the rest of the world. The crap that you're not doing your job that people expect you to do. You should be giving out good advice. You should have known this science. You should have been advising people, make sure that they take care of the deficiencies before they become infected with any infectious disease, whether it's coronavirus or anything else. But you've fallen short. You haven't done your job that people expect you to do and trust that you should be doing. There are some good medical physicians out there. I know that. But the sad reality is there are less good physicians who are willing to go outside the box, speak out, and actually tell somebody good evidential information, evidence-based information that could save a life. They'd rather wait till they're FDA-approved drugs or keep their mouth shut so they don't get ridiculed by their own profession. Gotta wait for their ad. Surprised it's not a pharmaceutical ad.
Tonic water and zinc. A St. Louis chiropractor is saying he's recommending this combination during the coronavirus. He made a Facebook video about it, and it has gotten millions and millions of views. Our Jenna Barnes is fact-checking his claims.
I want to know what we do know about COVID-19. We know it is a respiratory virus. We know
Chiropractor Dr. Eric Naputi runs Naputi Wellness Center in St. Louis. But his Facebook video about the coronavirus has gone far beyond his regular patients, with more than 13 million views.
Right now, I'm telling you right now, the answer is quinine. I want everybody listening right now to go do this. I want every one of you to go today, see if you can buy some quinine. If not, go get some Schweppes tonic water.
Quinine is an ingredient in tonic water. It was used to treat malaria hundreds of years ago. Now, another anti-malarial drug, chloroquine, is being tested in the fight against coronavirus.
Have about 3 to 4 ounces a day of that Schweppes tonic water. Take it before you go to bed or first thing in the morning, and take at least 50 to 100 milligrams of zinc. I'd say that again, 50 to 100 milligrams of zinc, okay? Do that every day as a preventative.
Naputi does tell his viewers his disclaimer is this is not medical advice, a point he reiterated when we spoke on the phone.
That's a well-known homeopathic treatment, and the side effects of this thing are absolutely little to none.
But medical doctors say
really
even
well.
if there's no side effects, there's also no evidence that it will prevent coronavirus whatsoever.
So right there, folks, I'm going to pause it again and just reiterate the fact that I showed you a scientific validated evidence and information right here. She just said that doctors say there's no evidence. There was a 2010 study that said that zinc inhibits coronavirus, not just any coronavirus, SARS coronaviruses. So if she's interviewing doctors and they say there's no evidence, they are liars. See, this is the problem I have with fake media and fake doctors. Doctors that need to go back to school and actually read research rather than being spoon-fed by Big Pharma. You're killing people with your bad advice.
Well, I've never made one claim at all telling anybody that any of these nutrients cures or prevents coronavirus.
It makes me upset. I'll just put it that way.
Medical doctor Fred Buckhold works at SSM Health St. Louis University Hospital. He says drinking tonic water and taking zinc likely won't hurt you, but
If you're doing this and then not washing your hands and not social distancing, good luck to you.
he says hand washing and staying home is still the best way to prevent coronavirus.
I need you guys.
So literally this medical doctor says, watch this, folks. Now I have to give credit to my staff, my amazing staff, Ashley helping with the TV or video and stuff like that. But my staff member, Taylor, found this. Hospital safety grades. You can actually find out whether your hospital in your area or the one you might want to go to actually gets a good grade on things like prevention of infection and how many people they kill by accident. You could figure that out. Guess what? This medical physician who fake news decides they're going to interview to be able to rebuttal this chiropractor's claims that zinc and tonic water could potentially help you. There's plenty of evidence, and I'll go through that in a minute. We're going to geek out at the end of this video. That's when I'll show you the scientific evidence that will refute, not only refute, but prove this medical physician and other medical physicians that supposedly told this reporter that there is no evidence of benefit against coronavirus. You know what? They're a bunch of liars. They're idiots. They don't deserve to have a license for a medical degree. They need to have it taken away because their lies have cost the lives of millions because they give junk science out or they give junk advice. Folks, this guy's hospital, all right, St. Louis University Hospital, got a D. I'm sorry, but if you get a D and you bring that home on a report card, you're going to retake that class again. You're not going on to the next grade. You're not graduating. They got a D. Not only that, they got a D, and they literally failed on their ability to prevent infections. They failed to prevent MRSA, C. diff, infections of the blood, infections of the urinary tract, surgical site infections after surgery. They failed at it. They can't prevent infections. Not only that, they failed in things like dangerous objects left within the side of a patient's body, surgical wound splits, okay, death from serious treatable complications. So they fail at saving people's lives when that's what they're supposed to do within a hospital. Collapsed lungs, serious breathing problems, not available evidence or information there. Dangerous blood clots, accidental cuts and tears. All those things they fail at. They can't prevent it. They accidentally kill people. They accidentally cut people open. They accidentally forget objects within the person's body. You know what? The one thing or two things they actually got good grades on. One, you're going to love this. Hand washing. Hand washing. They got a good grade on hand washing. But let me show you that medical physician who says there's no evidence and it's upsetting that a chiropractor went on Facebook, had a viral video that gave logical and scientifically validated information and suggestions of taking zinc or making sure that you're not deficient in zinc. That medical physician says, good luck with that if you don't wash your hands. What's this doctor think we're going to do? In chiropractors' offices all around the nation, they have zinc in their restrooms next to the zinc next to the sink. Zinc next to the sink. You put quinine, tonic water, and zinc next to your sink, and you don't have to wash your hands anymore. Is he an idiot? Does he think we're going to walk in and be like, ooh, we'll go pee real quick, and then I'm going to, well, I don't need to wash my hands. There's a community tonic water. Let me drink some tonic water. I don't need to wash my hands anymore. You're an idiot if you actually think the population is going to say, oh, a chiropractor said I could take zinc and tonic water. Maybe I just won't wash my hands no more. No, we're not saying that. You're an idiot. You don't even have anything logical or even you did give nothing. No good advice. None whatsoever that could save lives. Yes, maybe you did. Maybe you said you should still, when you're sick, stay away from other people, and you should probably wash your hands. I would agree with that, but the reality is you gave no logical information to actually help people. But you did get a good grade. But think about this, folks. The hospital got a good grade on washing hands and a good grade on staff works together to prevent errors. But when you actually look at their outcomes, they can't prevent errors. So they're working together to prevent errors sucks. They don't prevent errors. They still let people die of problems that are treatable and preventable. And not only that, they're good at washing their hands, but they can't prevent infections. So they're actually doing what they say and preach, but they're not actually getting the results that patients need, which is meaning they don't prevent infections from killing their patients. Do you see why I'm pissed off? You'll see why I'm pissed off when you go through the science with me. Wait till we geek out. And not only that, this next one, watch this. Guys,
to share this. Share.
Until FDA approved therapies and vaccines are ready. Jenna Barnes, 5 on your side.
Jenna also checked with the FDA, and the FDA says there are no approved treatments for coronavirus.
There are no approved treatments, and y'all should wait, do nothing until we need a vaccine and drugs. According to the Journal of Pediatrics from 1999, zinc, diarrhea, and pneumonia. You know what it says? It says thus on a worldwide public health level, it would be more likely to be more economically feasible than vaccines directed at specific organisms. They literally say the best thing we could possibly do to prevent deaths from pneumonia would be giving zinc. Making sure people weren't deficient on zinc. It would be better than a vaccine, costing less money and saving more lives, because zinc has the capability of preventing things. I'll show you research here in a minute. Preventing and actually, well, I wouldn't say preventing, because you'd still come in contact with the virus and your body's still gonna have to mount an immune response, but it would be effective in enabling your body's immune system to inhibit poliovirus, influenza virus, all kinds of viruses, rhinoviruses, and coronaviruses. Literally, that's what the scientific evidence shows. Zinc is necessary for that activity and response of your immune system. Why not give that? Why not tell people, don't be deficient, eat a healthy, nutritious diet? And here's the reality. I talked to a mom yesterday. You know what she said? She's like, Dale, I just need, okay, enough with the science. Just tell me what I need to do to protect my kids. I said, are you feeding them fruits and vegetables? She's like, yeah. I'm like, great. You know what? If you really want to work on better zinc levels, go ahead and get some shellfish. Make them drink or eat some clams. And it's just, oh my gosh, like for real.